We're going to get started this afternoon with our first panel of the afternoon that's on long-term rental housing assistance, its opportunities as well as its challenges. We're grateful to have the panelists that we have here today. And they're going to talk about the importance and the benefits of long-term housing assistance, some of the challenges with long-term housing assistance, policy challenges, as well as some innovative ideas and some solutions that organizations have been discussing and proposing recently. So I'm just going to take a minute to introduce our panel so you know who they are. Beth Shinn is Professor of Human and Organizational Behavior at Vanderbilt University. She's one of the lead investigators of HUD's Family Options Study, which, if you're not familiar with it, was a rigorous long-term study of the impacts of housing assistance on homeless families. And the findings were very interesting, and she will talk more about what they found, but it looked about the impacts on housing stability and individual and family well-being, and they were very positive findings. Daisy Franklin, who's sitting here on the end, is a board member of the National Low-Income Housing Coalition. She's also a vice president of the Connecticut Publicly Assisted Housing Residents Network, which is a state resident advocacy organization. And she's going to talk about long-term assistance and vouchers, some of the challenges, some of the benefits as well as some of the challenges. And then she will be followed by Barbara Sard, Vice President for Housing Policy at the Center on Budget and Policy Priorities. And she is going to, we have some longtime friends up here on the panel, as you can tell. Right. And she's going to talk about a proposal that the Center on Budget and Policy Priorities has put together, or has put forward, for a renter's tax credit to help with long-term housing assistance. And then finally, we have Aurand Gornstein, who is President and CEO of Preservation of Affordable Housing. And he is going to talk about their Family Self-Sufficiency Program, which is, it's the first FSS program to be operated by a private owner of property, of subsidized property. And so he's going to talk about that program. Two other things I just want to mention is that both Barbara and Aurand gave us a one-page handout that we put in your bags. So when you arrived yesterday or today, there were two handouts in there that you'll hear about on this panel, one from Barbara and one from Aurand. And then also the panel is organized in the same way that our other panels have been, which is we'll save all the questions to the end, and then after everyone has on the panel has made their points, we have mic runners who will go around the room. Just raise your hand and we'll call on you, and a mic runner will come up and you can ask your question. So, and with that, I'll turn it over to Beth.
Is this live? Yeah, all right, great. Thanks so much. I get to hold on to the mic. Last year I talked to you about the 20-month outcomes of the Family Options Study, which I'm hoping will come up. Okay, which Dr. Carson's predecessors at HUD funded, along with the National Institute for Child Health and Human Development, to try to understand the effects of different housing and service interventions for families who were recruited in shelters for folks who are homeless. And this year I'm back, and we'll just focus on the housing subsidy part of this and the 37-month outcomes. So we've now followed families for 3 years. There's a big cast of collaborators, especially from APT Associates. And we conducted the study in 12 communities around the country, perhaps one of yours. The study families were all, when we met them, they had been living in an emergency shelter for folks who are homeless for a week, and they had to be a family with a child that was 15 or under. Our typical family was a mom with 1 or 2 kids. The median income of families at the point that we recruited them was $7,400, so way too low to afford housing in the private market. 30% had psychological distress or PTSD symptoms. 63% had been homeless previously. The homeless service system is getting a little better at accommodating full families, so about a quarter of our families had a spouse or partner with them in shelter. Another 10% had a spouse or partner living someplace else because the shelter couldn't accommodate them typically. So I'm going to talk about the effects of housing subsidies compared to families who didn't get a special offer but could have gotten the housing subsidies 3 years later. And the subsidies were typically in the form of a housing choice voucher. 88% of our families who got offered a housing choice voucher leased up with some form of housing subsidy. So that's a very high lease-up rate, higher than in other studies. Families who experienced homelessness are eligible for these vouchers. They can use them, they can lease up, they can maintain them. And in usual care, the families in the same communities who didn't get any special offer, by 3 years later, 38% of them had managed to access some kind of subsidy. So everybody is getting better on most of our outcomes over the 3-year period as the usual care families stabilize, but we still have whopping effects of housing subsidies 3 years later. Okay, our usual care families who didn't get any special offer typically spent about 4 months in emergency shelter after the random assignment, and they participated. Usual care was not nothing. Usual care was $41,000 worth of housing and service programs over the next 3 years. So families were getting a lot, but if they weren't housing subsidies, that a lot didn't do too much for them. And so many of them were still not faring too well 37 months later. We looked at outcomes in 5 domains. I'll tell you briefly about each of those, starting with housing stability. So this is what the usual care families looked like 3 years after they entered homeless shelter. 18% of them reported in the survey that they had been homeless in the last 6 months. 19% had showed up in the local homelessness management information system, that's the record-keeping system for homelessness in those communities, in the last year in which we have data on everybody. And 28% of them had doubled up with another family in the same housing unit because they couldn't find or afford a place of their own. And the housing subsidy offers had whopping effects on these. They halved homelessness, they reduced shelter stays by about 3/4, they more than halved doubling up. And most of the folks who had the bad outcomes within this group were actually part of the group that never leased up with a housing subsidy. In terms of family preservation, we looked at recent separations of parents and spouses from our target respondent, who is typically the mother. Those could be ongoing separations or they could be new separations. In our usual care sample, homelessness tears people apart, tears families apart. So 17% of our families 3 years later had a child living someplace else. 38% were separated from a spouse or partner among those who had a spouse or partner with them in shelter. At 20 months out, the permanent subsidies reduced child separations by 40%. So families were less likely to be separated from their kids, that kids were less likely to go into foster care. We no longer see a significant effect at 37 months. We do see increased partner separations at that point. And that's kind of an ambiguous result because the partner separations are pretty highly correlated with domestic violence. And as we'll see, domestic violence was reduced by having a housing subsidy. So we think that in many cases, a housing subsidy enabled a woman to leave an abusive partner. Adult well-being impacts. I said many of our usual care families still weren't doing so well. About a 1/9 reported alcohol dependence or drug abuse 3 years out. A 10th reported intimate partner violence recently. A 1/3 reported fair or poor health. And the permanent housing subsidies reduced intimate partner violence by a 1/3. And they reduced psychological distress at both time points. They reduced substance use at the 20-month time point. So your housing is a mental health intervention. It's a substance intervention. It's a domestic violence intervention. And these were without additional services beyond whatever was available to people in their communities. Many of the facts that can sometimes, or the problems that can sometimes lead to homelessness, get reduced when people have permanent housing. What about child well-being? Well, child well-being outcomes, if anything, look better at 3 years than they did at 20 months. The usual care families, kids in those families, had attended on average a little over 2 schools in 3 years. So moving around from school to school is not great for kids. And they were absent about 5% of the time, 1.1 out of 21 or so school days in a month. They had elevated behavior problems compared to national norms. The permanent subsidies reduced kids moving around from school to school. So they have not only more stable housing, they have more stable schools. They reduced absences at 20 months and behavior problems at 3 years. So if you want your kid to grow up to be a neurosurgeon, give him subsidized housing as a child and be more likely to work out. Self-sufficiency, many of our families were not working. So this is a study that started kind of at the tail of the Great Recession, and only about 37% of our usual care families were working for pay in the week of our 3-year follow-up survey. Now, a lot of these families are parents of very young children. Kids below the age of 5 and infants are very likely to be homeless with their families. So some of those moms were caring for kids. We also have pretty high levels of disability and disability that limits work. And so our usual care families were still not working, and permanent subsidies reduced work efforts modestly, about 6 percentage points at 20 months. We don't see that still at 3 years, but we do see it between the waves. So we think that work reduction is real. Median income was only a little over $12,000 among the usual care families, so still too low to really afford rent on the private market. The permanent subsidies didn't affect income, even though they reduced work effort slightly. They did increase food security, which is a sanitized term for hunger, right? So our families were less hungry 3 years later if they got housing subsidies. So in sum, these ongoing housing subsidies, housing choice vouchers, and in some cases other forms of subsidy, had radiating benefits for multiple different aspects of family functioning. Few families were ineligible. We didn't know that for sure before we started the study. They took up the housing subsidies at high rates. They can use them. This is really a solution for homelessness. If we can get enough subsidies, we can do a lot about homelessness in this country. They could maintain them. There isn't something special about families who experience homelessness that they're not able to maintain their subsidies. The subsidies reduced homelessness. They had this radiating impact, and we get all of these benefits for about 9% more in cost than what we're paying for the usual care families. So, thank you.
So housing does matter, and housing first really helps. I'm going to tell you, as a resident and a person who has, I'm on Section 8, and I did live in public housing and also in private housing. And a lot of what was said is true. When a person gets housing, they are more stable, their kids go to school, they have a, they're able to build community. And that's one of the good things about having a Section 8. I lived in public housing, and public housing was my home. Public housing was, it was what you made it. And I made it my home. And then when I got the opportunity to move out, I also moved into, sometimes you think moving out of public housing is great, but you're also moving into a landlord. So you have to deal with that. A landlord could be just as like a housing authority. Housing authorities are landlords. But the voucher, when you look at the type of people that live in with the Section 8 voucher, you'll find a lot of them are they're disabled. You'll find families. If you want to have percentages, you have 51% of vouchers and public housing households included are adults with disability, and headed by mothers or single mothers households or working families. A lot of people might think, and I've been hearing a lot, that they say because people get, a lot of people that's on Section 8 or in public housing are lazy, don't want to work. I don't agree with this because I know I may not work, but here I am volunteering, doing many different things throughout this community. And there's a lot of people in public housing and Section 8 doing the same, going to school and working. When you look at the makeup of who gets this voucher, there's a lot of people as far as Caucasian, white Americans, African Americans, Latinos, all of them composed of the Section 8 and public housing. And when you look at the income, a lot of times the 30%, they pay the 30% of the income. And it may be kind of lower than what a fair market people may pay, but still, it makes it hard for them because they're making minimum wage. And a lot of times you'll say, well, why can't they do this? Why can't they do that? When you look at time limits and you say, well, you give them a certain amount of time, they should be able to move out or get off of Section 8 or out of public housing. Well, when you deal with minimum wage, and if you look at the facts in the National Low-Income Housing Coalition, you'll see that the minimum wage is not going to be what helps them get out when they have to work 2 and 3 jobs. And then you want the parent to participate within the school with the child, and or else had to fear about taking off time. That would come with having to deal with paid sick days. And a lot of people don't want to give paid sick days when a parent has to fear having to lose their job to have to get off of work to go take care of their child. Minimum wage jobs, they're scared to take off that time. They don't have to pay sick time. And they have to say, well, my child and their sickness is more important than this job. But then they have a penalty if they're under housing authority or if they have these time limits or have to deal with somebody telling them you have to work so many hours in order to benefit from this program. It makes a nightmare for residents because they can't function like that. It's just not reasonable to think that I have to work so many hours without having to miss any time, because when you have a child, you're going to have to take a time off. I had to take a lot of time. I worked and I had to take plenty of days off to go see about my child in school for various reasons. And also participating. Schools like parents to participate. So that was one of the things I had to do. I volunteered. I mean, be involved with my child's life. But if I'm working 2 jobs to try to keep my apartment and to meet these demands, it makes it very difficult. As with the difference I see with public housing in my community and with Section 8, with public housing, there's a lot of opportunities that's given to the residents that's not given to the Section 8 person, where they have schools offered to those in public housing. With Section 8, they don't usually have that. More money goes into public housing than it does go into Section 8. And I would hope that in the when you're advocating, that you also remember that Section 8 people want those same benefits. Like when you come to the enrichment programs in my community, when they want to try to get you out of public housing and off Section 8. So public housing, and one of the things the director does is they have this enrichment program. So they offer to the children cameras, horseback riding, canoeing. They expose them and enrich them to different things. But my child wouldn't be able to receive that because my child is a Section 8, the parents are Section 8. So I would like my child to also benefit from those kind of type of programs. I have to answer to the housing authority just like the public housing person do, but I don't get the benefit because the money is not in Section 8, it's in public housing. And it is good to be on Section 8 because I can go in my own apartment. I can, I don't have to have my landlord around, but as long as you have a good landlord, then you can have a good home. Because if you don't have a landlord that takes care of the property, sometimes you might wish you was back in public housing, because you know that the housing authority, you can go to them and you can complain and they'll send maintenance. You go the same thing to a landlord, sometimes that landlord may not come and do the work that he do, and if he does, he just do what he had to, a little bit here, a little bit there, and they call it a day, and you would have to live with it. Luckily, I don't live in that type of housing, but there are people who have. If you read the book Eviction, you'll know about those type of housings, and they truly exist. The NLIHC program that a lot of us benefit from, I would say advocate for it, because a lot of us need those type of programs. Those are one of the good things that public housing, and I don't know if other people are able to receive it, but the program is a good program to have, and it does help when it's cold and you got to deal with might miss a payment or on something else to try to meet your electric bill. But the NLIHC program is a good program to have and to help people with it. But the moving to work, moving to work may sound good, but I've heard clearly at our last conference, it was a wave of discomfort and uncertainty, and people didn't like it because they said it wasn't good. It sound good, but as long as you make it work for the people, working is fine and working is good. But when you start putting, like, if you don't do so many things, you getting evicted for it. That don't sound good to me. Don't sound good at all, because people lose jobs. People, it's a host of things of why a person might not work. But the move to work would put the demand. And when Ben Carson was talking, he was talking like, you're gonna put some things out there that you might not really like, and something like move to work or time, terms on how long you live there. And all I can say is, if the income don't change, I'm still going to be needing the housing. So I don't know how that works. And other expenses that they would have would be childcare. I go to work, I need childcare if I have children. I also need transportation. With Section 8, I was able to I know that people in some of my communities, they moved in the Cranberry part of it, because with fair housing, they're looking for the people to move in high opportunity areas. And some of those high opportunity areas, most people have cars, so they don't have to worry about buses. But I did, and other people did too. So it makes it hard for them when they have to walk a long distance to find a bus, to catch a bus, then catch a train to get where they gotta go. So you might want to think about those kind of things when it deal with when people move in Section 8 and move into those areas. Those are some of the problems that they might find. It might be a beautiful neighborhood, but sometimes people are not so nice when they find out that you have a subsidy. When you're the one that's getting Section 8, they start to think that differently. It may not be said, but they may think that you don't care about your apartment as they would their home. But like I said in the beginning, it's my home. Why wouldn't I care? Why wouldn't I care how my house look? Why wouldn't I want it clean and looking nice like yours? I would, and many others would. So when I speak, I'm speaking for myself. I am a resident. I'm Section 8. I do a lot of stuff in my community with the Fair Housing Advisory Board, and I'm on the Human Relations Commission and the NAACP. And all of these are civil rights, and all of them care about low income and extremely low income, as well as the National Low Income Coalition. They all care about the extremely low income and a low income person. And if when you look in your packages, there's a paper that will tell you what low income, extremely low income, all the different levels of affordable housing. So, because a lot of people will ask, what is affordable housing? Well, look in the paper and you'll see there's a lot of different tiers, and affordable housing to you may not be to me, especially being extremely low income. This is I'm pushing this 35, 65 in my community. 35,000 to 65,000, that would be affordable in my community. I don't know about yours, but in mine it would, because there's a lot of luxury apartments build up in my apartment, and a lot of them are 80,000 and up, So that's how it is in my community. A lot of development is happening, but we need the low-income tax credits. The extremely low-income people, we need to be supporting that and pushing that as well, because that's how they make those affordable units when we are able to move into, get Section 8 and be able to move out. We need to support that. The low-income tax credit is important. You need to study up on it and know why you should support it. Thank you.
Thanks, Daisy. So you've heard a lot about how effective vouchers can be, but as you also know, unfortunately, the chances of significantly increasing the number of families who can get housing vouchers aren't looking very good right now. And so the idea that I want to make sure you're familiar with is a proposal that the center developed for a renter's tax credit. And we're hopeful that if Congress considers tax reform this year, that there will be an opportunity to rebalance federal spending so that it's not so imbalanced in favor of, honestly, people who don't need help from the government in order to have a safe, stable place to live. So what does a renter's tax credit mean? So some of you may be familiar with the proposal we put out a couple of years ago, and the report we issued last month is kind of a updating and refinement of that concept based on a lot of the feedback that we've gotten, and I want to just give you the outline. So first, just to give you a sense of the scale, if a renter's tax credit, which would be for extremely low-income people only, under people's income could increase while they're receiving it so that they can better themselves, but to start, people would have to meet their local standard for being extremely low income. If the program, as we've proposed it, would be allocations of tax credits to states, like the current low-income housing tax credit, based on population. And when fully phased in at $6 billion a year, which is slightly less than is currently spent for the low-income housing tax credit, it's not that that's a magic number. We just wanted to propose a number that was somewhat smaller than the current housing credit. It could enable 720,000 households on top of the current federal assistance to have an affordable place to live. So at that level of funding, it doesn't solve the problem for everybody, but it would make a really significant contribution. So how would it work? We're proposing this time that the credits only be able to be used attached to particular properties. So it's a project-based renter's credit. A lot of people said to us before, vouchers are the best thing for people searching for units, and there's a lot about that criticism which we thought was valid, and that the way to start on the tax credit side, given the additional complexities of a tax credit, was just project-based. The states would select the properties that would get the credits. It could be new development through low-income housing tax credit or any other, wouldn't have to be a housing credit property. It also could be existing housing in the community, which after all is most housing. It already exists. The new development is a small share in any one time. It could be preservation, part of a preservation strategy. It could be a new acquisition of property by a mission-driven owner who wants to make part of the units affordable. So it would be more flexible than the current housing credit. The states would decide the allocation criteria consistent with whatever standards are set in the federal law and with public input, and would probably be combined with the same hearings on the qualified allocation plan as the current low-income housing tax credit. So for example, a state could decide to prioritize the credits for use for supportive housing in order to get savings in their Medicaid programs, or by deinstitutionalizing people with disabilities who don't need to be in an institution and could function in the community. They could prioritize expanding the availability of affordable housing in districts that are close to good, high-performing schools to help the kids. I mean, those are just two examples. But in terms of how states would have flexibility. The credits would be awarded, the states could choose to either give 15 years worth of credits to a selected development, and that's important, particularly if the renter's credits are being used along with low-income housing tax credits, so it's for the whole 15-year initial compliance period, and potentially coupled for sale to the same investors. Or states could serve more people by giving out the credits annually. There would be a great deal of flexibility. There would be requirements that only a share of the units in a property get these renter's credits, so that only a share of the units would have to house extremely low-income people. We would follow pretty much the policies that have been set for the project-based voucher program as amended by the Housing Opportunity Through Modernization Act that Congress passed this last year. So for the most part, up to 25% of the units could have renter's credits, and in tight markets and low poverty areas, it could be up to 40% of the units could get credits. Tenants would pay 30% of their income towards rent and utilities. So these would be income-based rents, just like in the current voucher program or public housing or project-based rental assistance. So this is one of the hugest differences from the current low-income housing tax credit. So in the housing credit program now, rents are capped, typically at 30% of the income of a household at 60% of area median. That means typically the rent is more than an extremely low-income household can afford to pay. There are proposals out now for some good improvements in the housing credit program. You're going to hear about Senator Cantwell's bill from her staffer this afternoon. And that new proposals will enable rents for some of the units to be lowered, but even then it would be fixed. So it might be 30% of the income of a household at 30% of median. That's better than 30% of 60. But it doesn't bring the rent low enough for someone who's living on SSI or someone who has lost their job. And given how much people's incomes fluctuate in the low-wage labor market, having that flexibility based on actual income is really important. The credit amount, okay, very similar to the voucher program, where the credit amount would essentially fill the gap between what the tenant can afford to pay at 30% of income and the rent for the unit, But given that it's being administered through the tax code and you don't have the kind of oversight that housing authorities now provide about the maximum rents, our proposal is to cap the rent that the owner can charge based on the what's called the small area fair market rents, which HUD sets based on zip codes, typically, or counties in non-metro areas. But we would give the states some flexibility because small area fair market rents are not always right for the whole zip code. Zip code is actually like 3 census tracts. So it can be pretty different markets, so that there would be flexibility to go 25% above or below the small area fair market rent as the rent cap based on the administrator's sense of real rents in the neighborhood. We also propose to allow states the flexibility to pay a landlord a little more than that gap payment between what's affordable to the tenant and what's a reasonable rent as an incentive, recognizing that landlords don't have to deal with this program and that particularly in lower poverty neighborhoods that it's a real challenge to get more landlords to volunteer. So the rent could go, the credit could go up to 120% of that gap payment in a low poverty area. So typically the credit would go to the landlord, to the property owner, not to the tenant. And that always surprises people. You know, think, oh, tax credits, that means I get it myself. Well, there are lots of complexities in having the credit come to the individual. First of all, tax credits come once a year. Most low-income people can't float the rent, waiting for a refund once a year. Secondly, people with extremely low incomes typically don't pay taxes at all. And so the credit would have to be refundable, which is a huge, I mean, this is politically hard enough, creating another refundable tax credit. You know, even the Republicans couldn't pass it for their own health care credits. So that would be really hard. So here the concept is that it's the landlord who takes the credit in return for reducing the rent for the tenant. That's going to work for some landlords, but who have tax liability, but others that are nonprofits or small landlords that aren't making enough money, that isn't going to work either. And so the proposal allows landlords to transfer the credit to other entities that are involved in the business of rental property. So that could be property management companies, it could be lenders or others. And it's more flexible than the current rules for the housing credit, where the investors actually have to become owners of the property. Our proposal would not require that, and hopefully, therefore, will have somewhat less transaction costs. Anyway, that's the basic outline. There's a 2-pager in your packets that kind of sums up these details, and then there's a report on our website where we go into some of this in more detail. But I hope that gives you enough of an idea to get what the proposal is about. Thank you.
Am I on?
You're
okay.
on.
Is that working? All right. And the slides are ready. So I'm with Preservation of Affordable Housing, called POA, and we're a nonprofit organization. We own and manage approximately 9,000 affordable homes, 9 states plus the District of Columbia. And we preserve existing at-risk housing, we produce new affordable housing, and we also undertake comprehensive community revitalization. I wanted to talk about one thing we're doing on family self-sufficiency. It's a little bit of a follow-on to what Dr. Carson was talking about on how we could help. It's one thing to build great affordable homes, but what are we doing for the residents living in our apartments? And that's what I wanted to talk about. So, as you know, as in Section 8 housing, if you're on Section 8 assistance, as your income goes up, your rent also goes up. And it's a disincentive for people to try and really go that next step on a job. In addition, you tend to lose benefits, the so-called cliff effects, as your income goes up as well. So what we're trying to do here is address that disincentive through one particular program that's been around for many years called the Family Self-Sufficiency Program. And through the great work of Barbara Sard and the Housing Partnership Network and Stewards of Affordable Housing for the Future and others, now private owners like POA that own and manage project-based Section 8 housing can offer this program to our residents. Prior to this was only through local housing authorities for public housing or tenant-based vouchers. So what's new here, and if there are any private owners in the audience, I know there are some, I'm hoping you will also consider this as a way to help your residents. The way it works is as your rent, if you increase your income, the rent that would have gone up, you would have paid higher rent, goes into a savings account, an escrow account, and you enter into essentially an agreement with us as the owner-manager that we're going to help manage that escrow account, and in return, you're going to work on a lot of different goals that you've set for yourself. And so that's how essentially it works. You're building up an escrow account over a period of years as your income goes up. And there are several really important components. We're not just saying we want to do the escrow account. What we're saying as POA is we want to provide the help to the resident so they can help increase their income. That includes financial education, financial coaching, which is one-on-one coaching. There's the savings incentive, and then partnering up with a lot of different community partners. So we've been teaming up with Compass Working Capital, which has specialized in this program for several years. Find them to be very effective at what they do and also very passionate about what they do. So POA staff isn't doing the financial coaching, or management staff isn't doing it. It's really by this third party, this independent nonprofit who really knows how to connect with the residents, how to do the recruitment, how to help them get to the next step. And it's really centered around their own, again, their own goals. It's not us saying, here's what we think you should do. It's that individual family, one at a time, setting their own goals. So that's kind of how the different components work for us. So this is just some data. We've started out at 4 pilot sites that we own, and we've only been at this for just over a year at POA. So we're learning as we go here, and we set a goal of 30% enrollment of the residents who are eligible to participate in this program at the 4 sites. We set that goal as a 5-year goal. The national average, I think as Barbara knows, is about 5% enrollment. That's disappointing, isn't it? I mean, a program that's been around, only 5% enrollment. I don't know what that feedback is. Am I doing something wrong here? Oh, my phone's ringing? Okay. I won't answer that. But then they don't get to add to that escrow. They can keep that escrow above that amount. Do you see what I'm saying? So we'd like to see that covered, and that would be the third piece of what we're talking about. So I'll stop there. I've got a lot of phone calls to return, apparently.
So I think we have about 5 to 10 minutes for questions. If anyone has questions of any of the panelists, feel free to raise your hand and we'll have a mic runner. There's a few mic runners around the room, and I'll just sort of try to start at one corner of the room.
I'm going to try to get you.
To go back and forth. I think Sarah is standing next to someone with their hand raised.
That's great. Hi. Thank you for your presentation. I have a question about the renter's tax credit. So one of the things we've learned, at least in Texas, is the implementation with the National Housing Trust Fund, which we're going to hear more about later, is there's hesitation at the State Housing Finance Agency to do an operating assistance program. They've never implemented them before, and I think that's not unusual for our State Housing Finance Agency. Have you had conversations with state housing finance agencies, and have you thought about any guarantees for the longevity of an operating assistance? Like how, if a renter's tax credit is in an annual renewal, or how long can a tenant expect to receive that?
The state can assure the continuity by allocating authority for 15 years of credits up front. So that mechanism essentially solves the problem. But if they allocate 15 years of credits to one property, that reduces the number of households who can be assisted. So the other thing they could do is, assuming Congress authorizes the program permanently, with not having a drop-dead date, they could make it could be more like the current project-based voucher program. So when an owner accepts a contract for a project-based voucher, they're only getting a legal commitment of a year of funding at a time, but there's a contract between the housing authority and the owner that says so long as Congress continues to provide funding for the voucher program, we'll keep supporting your project-based voucher. So basically, that's the two ends of the continuum there, and the state would have a lot of flexibility in between to make sure that there is no uncertainty about whether, in effect, the renter's tax credit is the same as operating assistance. So to make sure that it gets paid.
Anyone? There's a down in the front. Stephanie's coming with the microphone.
Hey, I'm Brandon. I'm from Charlottesville. We have a FSS program in our public housing that's administered by our housing authority, and it had been done pretty poorly in the past. We had a major problem with housing authority keeping that escrowed money once there was a lease violation, or when a resident didn't pay their rent on time, as that was a lease violation. So I'm wondering if POA has similar policies or has a better way of dealing with that issue so that folks' escrow doesn't just disappear and turns into their rent.
Yeah, I mean, we haven't had an issue yet, but I'm sure at some point it probably will come up. Is this on?
No.
Use handheld here. Use this.
I can't say we've had experience at that yet, but we certainly, with HUD, we have to file a plan of action, say exactly the procedures we'll be using, so we're going to make sure to follow that. Are you talking about a potential abuse of the program, or that?
No, it's just any type of lease violation, whether
They're not supposed to be.
They're not supposed to be doing that anyway.
We're not. But yeah. Okay. Yeah, I mean, I guess I haven't experienced that yet, but it could come up, and we'll just make sure to do what we're supposed to be doing under the program.
Any other questions? Any on this side of the room? No. And then there's one behind Sarah.
Sorry. I've got a question related to the usual care versus the housing subsidies study. You mentioned that it was 9% more expensive to provide the rental assistance, and I had two questions on that. One, if you guys looked into the proportion of that 9% that was related to the housing assistance payment versus the administration of the voucher and the program. And then secondly, if that 9% was kind of an average across the whole study area, or does that a percentage kind of vary by geography?
That's the average across the full study area. At 20 months, it was a wash. That is, the housing vouchers didn't cost any more than the usual care kinds of programs, but folks continued to use the housing vouchers, and they used fewer other programs if they were in the usual care system. So, you know, the housing vouchers aren't free, but you get a lot for that 9%. We also didn't look at any offsetting costs, like the costs of additional foster care in the usual care families.
And my timekeeper is telling me we're about out of time. Is that right? So one more question. So is there another question? If someone else has a question? No? So I'd just like to take a minute and thank my 4 panelists who did a great job in presenting their research and their ideas.